Greg Garcia here, one of the sports and shoulder surgeons. Today we're going to talk about a cartilage procedure. We've all talked about Maci before. You've seen my testimonials on this. This one's a unique patient. So this is a patient that on one knee had an open Maci done with me about 2 to 3 years ago. Did quite well with it, but had an open procedure. So an incision about this big because we did not have arthroscopic options. And then you've seen a few of these announcements recently, but in the last year, year and a half, FDA approved an arthroscopic method to do this. So we do a lot of these here. So this patient actually got the exact same problem on the other knee. And so he opted to do it, but wanted to try the arthroscopic option, which we have been teaching about. So we did the arthroscopic option. You can see the major difference. I mean, just the exact same surgery, exact same surgeon, but arthroscopically, huge benefit for the patient. And he's back to all his activities, and enjoy the testimonial to hear about the differences and sort of how technology and innovation has happened even in the last few years. Thanks.
All right, so I've had a double Maci in both knees. About 3 years ago, I had it in my right knee. It was a full open. It went really well for me. It went from basically being kind of immobile to having pretty much full use of my knee, no issues or complications. And then fast forward about 3 years later, I wanted to get the other knee done, and there was a new approach, orthoscopic. And I'm just kind of going to talk a little bit about the difference between the two. So with the right knee, it worked out really well, but it was obviously it had much more discomfort. I had a full open procedure. On my left knee, it was a very tiny incision. You really can't even see like a scar or anything. It's like completely different.
We can show these off.
Yeah, if you can see there.
If you can see it.
Yeah, it's like I have like normal scars in my life.
Exact same injury.
Yeah. I've had worse. I always tell people I've had worse flus. Basically, within 2 weeks you're full weight bearing, so it was really easy to get back to. You don't have as much of a muscular deficit, which is one of the tricks with a lot of procedures like this. Basically, by Christmas time, I was already squatting, deadlifting again within reason, the protocol. And then just like this month, I'm kind of back up to squatting like 225, deadlifting 225, which is pretty decent. I'm 48. And I feel pretty much back to 100%, almost like I was when I was 30. So I feel great, like no discomfort, no pain. It's pretty smooth. There's no like clicking or anything. I did the STP. I'm going to do the STP this year. I did the Chili Hilly actually. So that's a 36 or so mile bike ride in Seattle area. And again, it had no pain or discomfort or swelling or anything after that. Yeah, it's really great. So,
how did you feel about the recovery between the two in terms of PT?
The PT was, I mean, they're both not too bad for me. I don't mind PT, but the trick with open, so at least in my experience, most of the discomfort you feel is like the tissue that they're messing with. When you don't have like a very big opening, it's not really there's not that much pain, so it's less confusing when you're doing PT, because when you're doing things like lunges or squats and stuff, sometimes like, your nerves will try to start firing and it's a little bit more confusing. This was just like really simple and straightforward. Mostly you're just kind of following the guidelines to stay within spec of the tissue, because it has to develop over 6 months to a year. So yeah, it was pretty trivial actually.
Are you happy you got the final upgrade of this procedure?
Yeah. I mean, this is like, obviously it's like the future. I'm so happy I'm actually want to get involved and talk a little bit about with Maci to help other people. But I would really, like, if you have knee pain, I would highly recommend, if this is, what you need, looking into this. It's nothing like, I think Maci gets kind of a rap for like a long recovery. I even felt the same way about this. But in this case, not walking for 2 weeks and then maybe having a couple of months of like the worst restriction where you can walk, but like not like up and down a lot of hills. Mm-hmm. And then after that, it's, you start doing PT, which is just like a lighter version of what most exercise, people do, to, 6 to 7 months, mostly being able to do anything that you would need to do. I don't think it's a very hard trade. for what you get back in lifetime of mobility, and it keeps your joint biological, so it's kind of a slam dunk. I would recommend it.